Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about migraine drugs, old versus new. And as a practicing chiropractor who sees more than my share of headache patients, including migraine patients, and the author of a book on migraines and epilepsy, this topic really kind of hits home. Before we go on, make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel. Going back to this study, it was a huge review on medications, looking at 137 trials, almost around 90,000 migraine patients looking for acute treatment. So not preventative, but acute treatment. And really they looked at how many patients had relief within an hour or two after taking the drug and sustained relief. They looked at, did I mention, 17 different drugs, of which they included things like triptans, so like Maxalt, Imitrex, Zomig, Relpax. Those are the triptans. Those are the old school migraine drugs. They were originally designed because we thought that migraines had to do with the vasodilation. So like the initial thoughts were that the aura was from blood flow being constricted to regions of the brain, and then the body responded by opening back up. And so if we gave a drug like a triptan that constricted, so it's a vasoconstrictor, shrink the blood vessels, that would help with the migraines. Well, we've since thrown that concept out the door, even though we were on the right track, because blood vessel health has everything to do with migraines. But despite the fact that that's not really where the aura and how the triptans work, they still work. And they do have some anti-inflammatory effects to them, even though, I'll mention in a second, their anti-inflammatory effect is not nearly as powerful as what you get from the right lifestyle changes. The newer drugs, things like it's the calcitonin gene-related peptide antagonists, so CGRP, think Ubrelvy, Aimovig, those kinds of new fancy expensive drugs. And when they initially came out, they're like, oh, we're getting to the cause of the migraines, and it's really not, no more than the triptans are or any other migraine drug. It's just another way to control the pain. So, and before I go to the results of the study, everybody's individualized, and there are some people that do remarkably well with triptans, and there's some people that do remarkably well with the new drugs. I think those numbers are far smaller than we think that they are. But this study found that the triptans, especially there were 4 of the triptans out of the 17 different drugs they looked at, and 4 of these in particular were the most powerful, but they were more effective for acute migraine treatments than any of the other drugs. The new fancy drugs, the CGRP antagonists, didn't really do any better than over-the-counter Tylenol or ibuprofen in controlling those acute migraines. Again, there's some individual variations in there. And for me, none of it really matters, because if you're having true migraines, then you really need to, it's a sign that your brain is not happy with you, almost always from a blood vessel health standpoint. So if you do things that improve the health of your blood vessels, you're going to have an improvement in migraines, and God forbid we say cure them. But essentially, if you make the right choices where your brain is healthy, those migraines can all go away. I think that a chiropractor who does soft tissue work is a part of that plan, because there's definitely some interplay between the muscles and the joints of the neck and migraines. Then again, there are some people that are diagnosed with migraines that really don't have migraines. They're more structural headaches, beyond the topic of this video discussion. But, so, bottom line, if your doctor wants to try you on one of the new fancy drugs, maybe you could have a discussion about trying the tried and true triptans that have been around forever, because as a whole, they function better than the new fancy drugs for a lot cheaper, and we know what they do, what the side effects would be. Some of the CGRP antagonists, we don't really just know yet, because they haven't been around long enough. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.